feel that beat? Can you feel that? Move your feet, feel the rhythm, new position, ain't no stressing, move with me. Put your hands on my body, we ain't gotta tell nobody. Keep on grooving with me, don't stop moving with me. Let me know if I'm moving too fast, catch up with me, baby, don't pass. One more dance with ya, just one more dance with ya. Let this music move your soul, let your body lose control. Don't be scared, baby, just move with me.
Hello, and welcome to Monday Munch, the second of the three-part sex ed series. Tonight we're going to cover STIs and testing, condoms and protection, and birth control. And we'll have some actual demonstrations, not on like a live body, but we have about the durability and all those things. So I am the ringleader of this circus, the shit show, the circus, whatever you want to call it. I run kinkslayer.com and the whole brand of Kinkslayer, which is all about education and welcoming environment for all to be at. I'm getting adjusted on my uniform over here. Nice. And Alice just joined. But to my right, y'all's left, I believe, we have the wonderful and lovely Miss Juniper Jen, who runs her own brand, Juniper Jen. Makes handcrafted floggers, aftercare products, as well as an assortment of adult items you can buy from the shop, which is still in progress, still uploading inventory and all those things. And to this side, you have the lovely Ray. Ray is our parent youth advocate, 1,000%. I don't know if Ray wants to say anything about themselves. Or...
I'm Ray. I'm working harder on pushing my personal business too. Ray's Corner Customs. I do custom designs on canvas with spray paint and acrylic. I also do a little bit of graphic design. I edit photos, and if anyone in the adult industry is looking for someone to make flyers, I make some pretty bomb-ass flyers.
Absolutely. And to the bottom there, you have Alice, and they are absolutely our authority on trans rights and advocacy for trans people. So,
hell yeah.
Hell yeah, there we go. What is that? Oh, I was like, what the fuck is that? That's cool. Okay.
I'm going to be off camera for a little bit, but I'll hop on as soon as I can.
That is perfectly fine. For this chat, I believe I do have our viewer turned off, so we don't see who, how many, whatever. I sent a bunch of flyers out this weekend at Pride, so there could be, 100 people here. There could be 3 people as usual. Either way, welcome to Monday Munch. We love this shit show, whether you're here or not. We just hope that you join us, and if you have missed any munches and want to go back and watch, feel free to do so. And yeah, feel free to subscribe and follow all of us on all of our things and such. And yeah, so let's get started. So tonight, the first topic at hand, I don't have any banners made for it because we were doing a different format and I ran out of time. We switched it back to the original. We're talking about STIs or STDs. Most people know them as STDs. I think they've moved away from the STD to the STI as they are not diseases, they are infections. But there are a multitude. I did find out there's 30 different STIs. I don't have a complete list, but there's 30. Some are not so serious. Some are very serious, obviously. I personally have never had an STI, which is nice. I can happily boast that.
Surprisingly, same, even though I spent 2 years as a sex worker.
Right, see?
Surprisingly, not same.
Oh, yeah?
Yeah.
Well, that they're common. I mean, they do happen. I mean, it's not, to me, honestly, with the exception, I feel, of HIV and AIDS, I feel the rest of them, for the most part, are not as serious as people make them out to be.
So mine personally, I don't mind sharing. After one of the non-consensual situations I was involved in, I tested positive for chlamydia. Mm-hmm. Fortunately, it is something that an antibiotic took care of rather quickly, and I tested right away, so I didn't have time to have any real symptoms.
Good.
Very nice. And that, well, not very nice, but I'm glad that you were able to get tested and cleared up and all
not
that
have
stuff.
to deal with any of the symptoms of it and get it taken care of right away. Because I think that's an important factor of the process right there.
100%.
Which is why I am a huge proponent for anyone that is involved in, especially a non-consensual situation, go to the hospital, get checked out, get tested right away. So if you do have anything left over from said person that can be treated, it gets treated right away.
Absolutely.
Very good.
So when it comes to STIs, there are 4 main categories they use. There's bacterial, viral, fungal, and parasitical. Or parasitic, not parasitical. Bacterial is your most common, I think. Viral are your more serious ones, and then it kind of goes on from there. Like there are essentially 8 they consider most common, or 9 if you can, 10 if you break hepatitis down. Chlamydia, which is, I have this really cool handy book right here that I got this weekend at Pride. I love it. But chlamydia is exchanged most commonly through body fluids, not skin-to-skin contact. The same goes for gonorrhea, hepatitis A, B, and C, and HIV. So those, and trichomoniasis, if I'm saying that right, I can't remember how to say it honestly, is another one. I learned an interesting fact about that one we'll talk about in a minute. And then, of course, you've got like syphilis. What else? They consider Zika and Ebola to be potentially STDs. I also consider kids to be STDs too. So, and don't get it confused. STD is just a common term that I've used my whole life. STI is a more proper way to say it.
Least stigmatized to say it.
I feel like kids, the D is more accurate.
It is a lifelong problem. Herpes is
I love my kids.
because it is skin to skin and body fluids can exchange it. That's one I've always thought is more stigma than anything. HSV or herpes. There's 2 types. What else we got? HPV. That one they actually have a vaccine for now, which is nice. They've had it for a while though. Like I remember back in high school, it was becoming a big thing to get your HPV vaccine, but they were only doing it between a certain age range at the time. It was like before you were 12 and up until you were like 17, and then up to 23 to 25 or something weird like that. It was a weird age range, but now I'm pretty sure it's universal. At any age you can get it. And
yes.
The main reason is because HPV is directly linked to cervical cancer and anal cancer, interestingly enough, which is a thing. I guess cancer can be anywhere, but you don't really think of you think more colon cancer than actual anal cancer, which is kind of the same general vicinity, but the colon goes much further. So bacteria can be taken care of with antibiotics more often than not. They are not super serious. They are if you don't get anything done about them. Let's see. Chlamydia is caused by a bacteria called Chlamydia trachomatis. Often it has no symptoms other than some slight pain and unusual discharge. If you don't treat it, it can lead to infertility and pelvic inflammation, which is a whole nother segment of the effects of STDs is PID, pelvic inflammatory disease, which is just all of your insides being super inflamed and angry and eventually shutting shit down.
So
all of your pelvic organs.
Are we still talking about HPV?
We're talking about all kinds of things.
Okay, so the reason why they have you get your HPV shots and everything so young is because by the time you're a 26 to 30-year-old or older adult, you may already have been exposed to it. And they have you go ahead and get treated for it early, so it's already in there doing the job, ready to fight.
I know HPV is a common, like it has multiple different strains. Only a few are actually sexually transmitted or considered actual STIs. Oh, back to chlamydia. They diagnose with urine tests or like an actual culture swab, which they call it a.
Is that where they stick the wiener, the Q-tip up your wiener?
Sometimes.
Is that a culture swab?
That
Or
can be.
Urethra?
Your urethra, yeah. Damn, what's it called? Wet something. Give me just a second. Sorry, I'm trying to find the terminology for the type of testing. They call it a wet mount. There you go. It's called a wet mount. Is a specific type of testing they do. That's often treated with a Z-Pack, is what most people know it as, is a Z-Pack. They also use that for yeast infections, don't they?
Maybe. I've never had it used for a yeast infection, but I've had it used for all kinds of things like
Z-Pack, that's azithromycin, right?
yes.
Yeah.
Last time I had that, it put me in the hospital, and I found out I was allergic to it.
Oh, fun. They also use doxycycline too. I was watching a
That's what put me in the
presentation.
hospital.
Wow. Well, you don't take doxycycline and you don't take azithromycin, or yeah, that's but not. I was incorrect. I don't think it's yeast infection. It's bacterial vaginosis. Is something they
Yes.
used to treat that with.
Mhm.
I had a partner that had severe bacterial vaginosis, as in any type of foreign entity got involved, like whether it be like a hair, dirt, dust, fucking anything that wasn't supposed to be in the vagina got in there, and it just wreaked havoc. So Z-Pack, eventually she got good enough at it though, she could feel it coming on, and she's like, let's go and go to the hospital, pop the Z-Pack and be done with it. Like, to the point that the last time I went with her, the nurses gave her like 10 of them, like 10 of those little pills, and was like, here you go, just save yourself some time. You know what you're talking about, you know what's going on. So which is nice.
Yes and no. I mean, it's nice that she was on top of it, but not nice that she had to be that on top of it. That sucks.
Right, but it's nice to have a nurse that listens to, or any kind of medical professional that listens to what you know from experience.
That
Because
is
like,
very good. Yes.
because she walked right in and was like, this is what's going on, check me out, give me an exam and all that stuff. This is what's going on. This is what you're going to find. I've been through this enough times, but please still do thorough stuff. Make sure that this is what it is, but more than likely that's what it's going to be.
I was just
Good on
reading
her.
Z-Packs were treatment for COVID as
Huh.
well, as long as it wasn't over 28 days of being.
Yep.
Wow. I mean, I guess it's a antibiotic, so
It is indeed stronger than amoxicillin.
Z-Pack, doxycycline, and ciprofloxacin are 3 really big, heavy hitter antibiotics that they use for a lot of different purposes because they're very, very strong.
that's something. I was at the doctor with my dad today, and that's something he kind of explained about a whole different medication. Was we use, stronger medications are used for multiple different things, because like he has some kind of it's a blood disease that makes him kind of itch, and they also use that medicine to treat other things. And he was like, why is it says it's for this, and why are they giving me that for this? He was like, well, strong medications often are used for more than one thing. It's kind of like penicillin or amoxicillin is used for many different things.
There's a lot of antibiotics that have multiple purposes. When I was first diagnosed with gastroparesis, I was put on an antibiotic specifically to stimulate my stomach muscles.
It's interesting.
It's quite interesting.
But us talking about the antibiotics and the treatment of this only reiterates that it's not an STD anymore, it's an STI.
Mhm. Because if I'm not mistaken, they consider a disease something that's not treatable with medication, right?
Not curable.
not curable.
So like a disease is one that's going to stick around even if you get treatment for it.
Yes.
Okay.
A disease, you can pretty much treat the symptoms, but not the actual cause.
So HIV would still be considered a disease, right?
Yep.
Okay. And that's why I still use that interchangeable STD, STI, because some can be lifelong, and not necessarily curable, like HSV or HIV. But then you have things like gonorrhea. Like I said, I've never experienced gonorrhea. I don't know what it is. I know that gonorrhea and chlamydia are two quite common. That people are just like, oh yeah, I've had this before. So it's one of those things.
Kind of the STD, STI thing is kind of giving me square rectangle vibes again.
Yeah, pretty much. It's more or less people like to sound friendlier about saying STI when a majority of us grew up with STD, and that's just kind of how we consider it. It's a part of our vocabulary. It's not
umbrella term.
We're not meaning to degrade you or make it sound like you're dirty or anything like that. It's just what we learned.
That's also why we have shifted away from saying that you test clean and instead saying that you would test negative.
Right.
That's when I got to work on myself, honestly.
But it's just part of your vocabulary, though. If you say you're clean, then you're clean, and that's cool. Most people know what that means. A lot of times, it's your more activist type people and your educators that are like against that terminology. But to the average person that you're speaking to, if you say, no, I tested clean, then cool, or I'm clean, and they know exactly what that means.
It means you just got out of the shower.
Right. So, and I wish like we weren't so much on social media right now, because like the pictures of these diseases and these infections
that's what I
do
remember.
Much more justice to how severe they can be, but they're also used as scare tactics.
Yep, that's what I remember from class.
That was a big part of a lot of sex ed, and still is, of the if you have sex, this is guaranteed to happen.
Your junk's going to look like this.
You're going to get these diseases and you might get pregnant and you're also going to die. Maybe not in that order.
You're going to die before you get pregnant, and then you're going to be put in the casket with a disease. Like, what happens. That's exactly what happens. Totally wrong order there, but whatever. So gonorrhea is a little more painful and a little worse than chlamydia. It does cause pain and does have discharge from your genitals. If not treated, this is something I did learn about it from that same presentation. It can spread to your joints. That's quite an interesting one, and then it's a little more difficult to treat and can cause more problems such as infertility and stuff like that. Culture swabs, once again, the wet, whatever I said, I lost it again. But those culture swabs, or they can test your urine, which is a lot of ways that these things can also be tested. Which is if you go in for a check, a lot of times they either do a swab or they'll have you pee in a cup. But a lot of times these doctors won't test specifically for certain things unless you request it, and they feel like you may need it, which is stupid.
Even like at my last checkup, I asked my doctor, hey, when I'm going in for my lab work anyways, can we add an STI panel to it? And his first question was, why? Why do you feel that's necessary? I'm like, because I'm an adult that is sexually active.
But you're also dealing with Florida doctors, so they got their degrees. Most of them got their degrees from a cereal box.
Bad.
Once I explained it, he agreed with me and agreed that it was the responsible thing for especially somebody that has multiple partners to do on a regular basis.
Right. And, I tested myself last year. But the kind of general rule of thumb is before or after new partners. Go ahead.
Before and after.
Before and after, absolutely.
Also, even if you don't have a new partner, it can be a good idea, depending on your personal sexual history, to still get at least once a year, because there are some things that don't always show up right away.
Yeah.
And there are instances where you could still have that contact with the bodily fluid. Some professions like EMTs, it's suggested they get them tested pretty regularly.
Mhm.
Yeah, so gonorrhea is a shot. Some complicated medical words, ceftriaxone, I don't know, ceftriaxone, maybe. The medical words always fuck me up. And then Z-Pak pills as well. So syphilis, if I'm not mistaken, that's what killed like a lot of pirates and shipmen back in the day, right? Was it syphilis?
I think you're thinking of scurvy.
Scurvy, probably. Same
What came
thing.
to mind.
Syphilis is what killed Al Capone.
Oh, okay. It is a bacteria. It starts as a painless sore on your private parts, and then it spreads into a rash, and then has later effects if it's not treated. It is diagnosed with a blood test, and then that's the one that can still be treated to this day by penicillin, which was found, it was invented after somebody in World War One, from mold and bread.
It was mold on fruit, but it was mold on something.
Yeah, it was mold on something. But yeah, that's pretty neat. We found out, if we eat mold, we can cure syphilis.
If we eat specific kinds of mold.
Whatever, just run through your cabinet. Anything, if you think you might have syphilis, just eat you some moldy bread and see what happens. Do not take my advice. I'm not a doctor. Just want to clear that up. Let's get on to the more serious serious, the more serious STIs.
Wow. That's a hell of a blooper.
So herpes, HSV, like I said earlier, I feel like that's more of a stigma than anything. It is quite painful. Your first time that you have it, they say, is like the most painful, because your body's kind of reacting to something new, and there's something new happening to your body, so your body's not prepared to deal with it.
That makes sense.
Yeah. So if people don't know what herpes is one, it's caused by a virus. It is a viral STI, but it puts pretty rough blisters on your genital area, and rarely can you spread. Trying to remember which way this goes, so somebody might have to correct me. HSV2. Fuck, you know what? I'm not even going to attempt to do that. We're gonna Google this the right way. So HSV1 is more of the oral cold sores and stuff like that. So it's hard to spread HSV1 to the genitals, but it's easy to spread HSV2 from the genitals to the mouth. So that's something to look out for. But I don't think it's not the same virus, like a different strain. What else we got here? They do have really good medication for HSV now, or for herpes. I had a friend of mine that had a partner for a while that was negative when they got together, knew the risks, took the risks. And even though with unprotected sex and all those things, because she was being responsible taking her medication, and they were, not having any kind of sexual interaction whenever she was having a flare up, like 6 years later, he still tested negative. So, it was partly on her to be responsible about, her diagnosis, communicating what's going on, letting her partners know before anything happens, and then also, allowing them to assess that risk, essentially.
As with all things, we're only 24 minutes into it. Communication is key.
Absolutely. That's the gamble every time, is how long is it going to take us. I think last week was the record. It was like almost 2 hours in. So herpes has no cure, but there are medications for suppression to help reduce the outbreaks, help reduce pain, and help reduce transmission. And the only way to test it for it is to actually test the sore, the fluid that's in the sore, as far as the genital version goes. If you get cold sores frequently, more than likely you have HSV1. Congratulations.
Cold sores and fever blisters are not the same thing either.
Right. I got a cool paper on monkeypox. I know monkeypox got... I wish they would have had a better name because nobody takes it serious. Yeah, then again, when chickenpox came out, I'm sure nobody took it serious either.
Or mad cow disease.
Mad
all
cow
the
disease.
crazy animal.
Right. Just stop naming stuff after animals. Regardless of how it can transmit or where it came from. I don't think chickens have anything to do with chickenpox. Somebody's going to have to look that up, though.
That face, Alice.
Right. So this comes from the Cabarrus Health Alliance. It talks about monkeypox. It says it's a rare but serious disease caused by the monkeypox virus. Monkeypox can make you sick with symptoms like a rash, which may look like pimples, blisters, sores, and often with an earlier flu-like illness. Anyone who has close contact with somebody that has monkeypox is at risk of an infection regardless of who you are, what you do, and if you're sexually active. It can spread to anyone through direct, prolonged physical contact. This can include sexual or intimate contact, close dancing, cuddling, and kissing. Go ahead, Alice.
Apparently, chickenpox got its name because the blisters look like chickpeas.
That's weird.
That's according to the CDC.
That's weird.
Okay.
So monkeypox can be spread by living in a house or sharing a bed with somebody who is infected or sharing towels and unwashed clothing. So far, it honestly sounds like a staph infection. I'm not sure exactly if it is, but it's what it sounds like. There's the same kind of transmission of touching anything anybody that has it has touched and all that stuff. Can be spread
Sounds
through...
like it's spread very similar to chickenpox.
Right. Can be spread through large respiratory droplets. These droplets can generally not travel more than a few feet, so prolonged face-to-face contact is required. This one's still new. I know they have a vaccine for it, and a lot of these places, a lot of these Pride events have people on site to give vaccines, which is really nice. So if you don't have monkeypox or you haven't been vaccinated for it, you should. It's not going to hurt you to get vaccinated for it. Go ahead, Alice.
I just want to acknowledge for a second that monkeypox got treated real shittily. For a while, the CDC was saying that the main driver of it spreading was explicitly male gay sex.
Yeah, it sounds like the 80s with AIDS. Mm-hmm. And that's not the case. Like, anybody can get it. And that's what I like about that paper. It says at the bottom, anyone can get it. Mm-hmm. And you can get it regardless of being sexually active. So just because you contract monkeypox somehow doesn't mean that you were being a dirty little whore, as the CDC would put it. Oh, let's see. Oh, trichomoniasis, I think is how you say it. That one was an interesting one. Yes, that was interesting because we did learn that men can carry it and have no symptoms. Only women will have symptoms for it. And I'm not sure if that just means like biologically female or how that aspect of it works, or if intersex people can get it or something like that. Might be something interesting to look up. Which I like this little booklet because it's not educationally watered down to death. There's an asterisk here that says STI stands for sexually transmitted infection, which can spread through skin-to-skin contact and bodily fluids. And the asterisk there says pre-cum, cum, vaginal fluid, rectal fluids, blood, and breast milk. So, like, they're not just saying semen and other bodily fluids. It's like, call it what it is or what people know it as, and that's nice. It says it may surprise you. It's possible to not show any symptoms, even if you've been exposed to certain STIs. Hepatitis was bad back in the day. You don't hear about it so much no more outside of like a drug community for the most part. Go ahead, Alice.
There are dating sites specifically for people who are positive for hepatitis.
There are actually sites for people that are HSV positive, HIV positive, Hep positive. Like to me, it's really nice to see those things because it means you don't have to be alone. Oh shit! All right, so we got somebody. Yep, read that out loud, please.
For God so loved the world that he gave his only begotten Son, that whoever believes in him should not perish, but have everlasting life. For God did not send his Son into the world to condemn the world, but that the world through him might be saved. He who believes in him is not condemned, but he who does not believe is condemned already, because he has not believed in the name of the only begotten Son of God.
Okay, you're
that's
definitely in the wrong area.
That's all given as a quote, and there's no Bible verse mentioned.
Right.
I would just like to say we are officially on our way to being big. Our first Jesus troll.
Speaking of Jesus trolls, I got one to tell on me to the cops this past weekend.
Fuck yeah.
Like, he was out there protesting, so I'm just talking my shit, enjoying myself, knowing I'm not going to get anywhere, but just enjoying it. Everybody was like, don't waste your time. I finally was like, I kind of get off on this. So everybody laughed. And eventually I got him so flustered and frustrated, he shut up. And as we were walking away, we went and done some spanking, come back across the street. Oh, no, we didn't cross the street. We stayed over there. And the cop walked up to me because I had a speaker. So, and I was using it. I was absolutely using it. So if the cop watches this later, I was absolutely using that. It was not John 13:16. That's John 3:16. Get your shit together. But I walked back across the road, and this cop walks up to me. He was like leading me, like he was fine with what I was doing because he was leading me. He was like, that speaker and microphone are for your live stream you're doing, right? I was like, absolutely. He's like, good, because that guy says that you're using it to be loud. I was like, no, sir. He's like, okay, carry on. So I got somebody to tell me for, harassing Jesus followers, for harassing other people.
I did enjoy the booklet that they gave us.
I threw it away.
Oh.
Yeah. It was why they didn't even answer their own questions in there about why transgenderism is crazy and wrong and blah, blah, blah.
Because obviously every single one of us is immeasurably evil.
Right. Absolutely. I mean, they've been watching Munch. They know.
We did have a really good
time
at Pride.
Jesus follower, you're absolutely welcome to stay. The religious stuff is not going to fly here, honestly. But kudos to you as long as you can be a good person. If you want to say Jesus loves you, that's fine. He doesn't love us, I assure you. Sure. And that's okay. Jesus loves us. God doesn't. Jesus loved all the people. But peace out. Have the night you deserve. Back to what we were talking about. That was very nice of them to wish us luck, though, after even kind of being an asshole.
So even though, we had that interaction at Pride, overall, it was the fucking best.
That was the best part.
We actually gathered some really cool resources that he's looking at Munch right now. He's just not told y'all about them.
I've got a bunch.
Who are they from?
This was from, ironically, the place is called Gilead.
And they were really awesome people. Very, very educational, willing to help us on our journey to educating as well. And
if you don't know why it's ironic, if you've ever read The Handmaid's Tale or watched The Handmaid's Tale, their utopia of Christian fascism is called Gilead. So I love the irony there. I don't know if they did that on purpose or not, but I'm down for it.
I kind of doubt it. They are pretty awesome. I don't want you to lose your place. Sorry.
That's
mister.
right. So now we're talking about the testing of things. Anybody else got anything to add? I know we didn't talk about HPV much, but HPV has multiple ways to spread because it is multiple different things. If you have warts of any kind, you have some strain of HPV in your body. It does not necessarily mean that you have sexual HPV, which is only a few specific strands, squares and rectangles. Let's see. So the high-risk strains, which cause about 70% of cervical cancers, are strands HPV 16 and 18. Low risk are HPV 6 and 11, which cause about 90% of the genital warts. And then there are other high-risk strains such as 31, 35, 45, 52, and 58. It is the most common transmitted STI. And most infections clear on their own. That's neat. It says generally safe to keep having sex as long as you are taking necessary precautions. So, although the warts part of it will probably be lifelong, it will still clear up from its own infections. So that's neat.
The flare-ups will clear up. The infection itself will remain in the body.
There you go. Because that's one of those that is it curable even if you if you get the vaccine after exposure, or
the vaccine is preventative.
Okay.
It'll keep you from contracting it, but the infection stays once you have it, and then you can treat the flare-ups as they happen.
Okay. Cool. Oh, yeah. So let's talk about testing. See, I'm so glad I got these because all the information I need is right here from reputable sources.
Hell yeah.
No Googling today. So the only thing they have on here for visual exam to be able to look at and go, okay, that's exactly what that is genital warts, the HPV variant of genital warts, but not cervical or anal cancer. Obviously, you can't look and see cancer. I thought I was going to say warts, and that's why I was including that. Urine sample, only 3. Trichomoniasis, is that what you said it was? Trichomoniasis. That one, gonorrhea and chlamydia are all found with urine samples. Oral fluid sample, HIV can find that, or it can be found there. Blood draw or a finger prick can be for hepatitis A, B, and C, herpes, HIV, and syphilis. Huh. Okay, yeah, it makes sense. I said that wrong earlier. You can test for herpes beyond the actual sores because it is in your bloodstream, right? Mm-hmm. And it can be found at any time.
Yep.
Cool. Okay. Now, something I am curious about is if you have herpes, can you contract it non-sexually, like blood exchange? I'm not sure about that. I know, it's.
If I understand your question, the answer is yes, because the blood carries the infection.
Okay.
So, if you're sharing needles, for example, then that could cause it to spread.
Okay, so you can get herpes from a dirty needle.
Yeah.
Interesting. That is not a way I ever thought you could contract it. It's nice to know these things. I know, HIV is definitely blood exchange.
Mm-hmm.
Now, I did learn back in my training for police stuff, we were going through bloodborne pathogens and stuff like that. That if you are exposed to something like hepatitis or potentially HIV, you have a certain period of time that you can get to a medical professional, and they have something that can help prevent you from contracting. Go ahead.
Later on, we have prevention methods, which was something I was told to talk about.
Okay.
But that's part of it. There is pre-exposure prophylaxis and post-exposure prophylaxis.
Okay.
The pre-exposure is within 48 hours ahead of time. The post-exposure is as soon as humanly possible.
That is quite neat then.
There's like specifically HIV is the big one for the post-exposure. Like if you go into any hospital, any ER, anywhere, and say, "Hey, I think I was exposed to HIV," they will have it on hand to give.
Very nice. Okay. Swabs for testing: chlamydia, gonorrhea, herpes, HPV, the cervical and anal cancer variety, and trichomoniasis. Right? Am I saying that right again?
Trichomoniasis.
Trichomoniasis. I keep saying try.
It's commonly referred to as trick, is how I remember that it's trichomoniasis.
Okay. That helps.
Back in the dungeon I worked in, it got called Tricky Dick a lot.
That works. I say it was fascinating to learn that is truly asymptomatic for men.
Mm-hmm.
That's quite.
That's why the dick was tricky.
This tricky dick. You were absolutely great. That's very fitting.
Most STIs have significantly lower symptom rates for penis holders than they do for vagina holders.
That sucks.
Not that it's particularly relevant to this conversation, but fun fact: HRT will flip that. Like if I catch one of those now, it will be as though I were born a woman and contracted it.
So
Interesting.
It fuels itself off of your hormones.
And there's a lot that changes inside your body because of your hormones.
Right.
So like internally, minus missing a couple of organs, like it's a woman's body.
That's interesting. That's a good fact to know. That's really that's something I'd love to see more research on if somebody ever sees this and wants to do like a full clinical study, like to learn how HRT and STIs are,
interact with each other.
Yes. So it says some are curable, most are treatable. If your results come back negative, remember that testing isn't a one and done thing. For example, if you're sexually active and have had more than one partner, had anal or vaginal sex with someone who has been diagnosed with HIV or diagnosed with another STI since your last HIV test, you should get tested for HIV at least once a year. So HIV is an important one to get once a year, apparently. That's cute. Would you like to talk a little bit about like prevention stuff? I know I've got toys and stuff to.
Condoms are not toys.
They are toys. You can blow them up.
I'm gonna agree with Jen on this one. They're not toys, but they can be fun.
Yes.
And toys are fun.
No.
Okay, a stick out in the yard can be fun, but it's not a toy.
It absolutely is.
That one absolutely would be. So
before they start
condoms,
playing with I'm sorry.
Condoms are tools, not toys. And those tools keep you and your partner safe. The first thing, like if I'm going to start talking about condoms right now, the first thing I want to say is if you meet someone who says they don't fit or they're not comfortable or I can't like get inside of one, have him pick whatever one he says doesn't fit and just pull it down. Do exactly what Mister's doing right now.
Does it fit? Oh God, it doesn't fit.
And then have him show you his dick, and if it's not bigger than his arm, don't fuck with it.
Oh, it'll fit on your leg if you try. And let's be clear that even stretched out like this, it's not uncomfortable right here. It's a little snug, but it's not uncomfortable. So get your shit together.
There are some people that through personal preference do not like the way that said things feel. They do feel restrictive, but they technically are not. And that is a boundary that is to be discussed between individual partners.
I am one of those people, and I'm fortunately extremely sterile. But if I have a partner who says, hey, I'm not having sex unless there's a condom on, that's not something that's negotiable. Period.
That's me. Keep them children away.
Back again to communication.
Everything's communication.
So for a while,
that's a fun condom. What brand was that?
This is just QR Care or Q Care. I'm like over here trying to just keep proving the point that
It's red. Does it smell?
Mister, do not pull that down over your face.
no, I'm not that stupid.
I love the seriousness you took in that because you know.
I like rubber.
It's not even too very rubbery.
Oh,
But like, so there we go. For more for the it doesn't fit bullshit.
I would
And by the
also
way,
like-
go ahead, Ray. Sorry.
I would also like to point out that there is a different type of condom for everyone. Like, no matter what allergy you have, you can find something that will work if you feel like it's needed.
Just also want to add that I have this thing stretched
Properly
out
dressed for the
in
occasion.
my arm as far as it can go.
Mhm.
So yeah, let's smash that whole it won't fit bullshit right now. Here we go.
Yeah, if your dick is bigger around than Mister's head and longer than his arm,
You're never
you
having
might
sex.
want to. Yeah, you might want to look into something other than humans.
That's a really
I'm
good.
not advocating bestiality.
No, go like find a mountain range or some trees or some shit.
Right.
You're going to kill people with a dick that big.
Oh, see, so I did break it. It took all that to actually break my condom.
I will say, on the breakage side, specifically like very vigorous activity, especially if there's not enough lube or there's not condom safe lube being used, can cause it to break.
Know your materials and know which materials are compatible with which lubes.
Step 1, condom. Step 2, lube. Step 3, winky face.
Yeah, lube on the inside of the condom is not going to be well. It's going to make it slide off. I mean, it comes with like some lube on it already.
Yeah, condoms come
But,
pre-lubed
yeah.
inside.
It should have just enough lube to keep it from like skinning your dick while you're doing things.
Right.
And, like,
That hurt my dick.
Right?
but you don't always want to assume that your partner is going to be producing enough lube. And like if you're not using a hole that lubricates well at all, then you should bring extra lube. If you think you have enough lube, use more every time.
Right.
So, as the condom baby of the group, I don't really know all of your experiences, but I know that I was told a story of my mother laying in the bathtub because the condom slipped off. And she called the hospital. They told her to lay in the bathtub and have him a hot bath. Sorry, you guys. That's probably important. Hot bath and have him go up inside and try to receive said condom. And that's how I'm here.
You and
me
going
But this little thing that I found, if my mom would have read it, I might not be here. It says stop immediately, withdraw, carefully get rid of the broken condom, and then there's some follow-up things that you can do, like the morning after pill.
Mhm. Has anybody go ahead, Alice?
Just a quick note since we're talking about Plan B or the morning after pill.
Mhm.
If you're over 155 pounds, take 2.
Yep.
Okay.
So that's important in reading the information on your box before you take this drug and doing your own research. Always, you guys, no matter what we say about any of the things, you always do your own research. But yeah, I just felt like that was important.
What were you gonna ask, Mister?
Oh, have any of you had to take Plan B or had that experience? Because from my understanding, it almost essentially brings on a period, correct?
Yes. What it does is it stimulates the body to reject everything that's in the uterus. That way, if there were a fertilized egg to be implanted, it would be flushed out with said tissue.
A bitchin' period.
Yes, Alice.
I've obviously never had to take Plan B myself, but I have on a couple of occasions back when I was living in a cult, had to prepare the biblical bitter water, which is wormwood tea,
Yes,
which does the same thing.
Really?
it does.
But if
It
you
does.
if you oversteep it or if you make it with too much wormwood, it can kill the person. So like, don't go that route.
Right.
It is a very, very old remedy, used by a lot of healers in medieval times. It is effective, but like you said, it is very easy to give someone a lethal dose.
Mhm.
And as far as the cramping and contractions and all of that you will get with the Plan B, with wormwood, they are significantly worse, but they last a shorter duration.
Okay. Very nice.
Basically, it squeezes you like an orange faster.
Squeezes you like an orange. I love it.
Would you like to
I
get
mean,
I'm going.
your banana's pretty dirty? I think that should be brought up that you should always wash your banana.
Wash your
first.
bananas because this is a dirty banana. It's not even a real banana. Just so you
A
know.
condom is not a thing to use just because your banana's dirty.
Yes.
no.
No,
That's
you should clean your banana and then put a condom on.
right.
Yes, hygiene is always important. Even if you're not going to be using a condom, hygiene is very important just for pH balance.
Mhm.
Because back to the conversation about the STIs and stuff like that, although it's not technically an STI, bacterial vaginosis can come from dirty things being inserted.
It can come from anything that throws the natural bacteria biome off.
I'm so not a dirty little slut. I've always been so picky about what is near me and inside of me, and
It can even be from something that isn't necessarily dirty. Like a lot of people now, especially on cam apps, are getting bacterial vaginosis from their lushes.
gotta be very careful. Go ahead.
Toys got to be clean too.
Yes.
Go ahead, Alice.
Since we were talking about pH, I just want to mention it. If you or your partner aren't using a condom and inside, that if it's left for longer than like maybe a few minutes, can fuck with your pH and the bacteria.
Interesting.
Mhm.
Okay.
So like, don't like go get like bleach or harsh cleaners or anything. But maybe like if that does happen, go douche with like some clean water.
Mhm.
Just water though. You don't want to fuck anything up.
Right. So, as in the traditional sense of sex education, since I can't show my dick on social media, so banana,
On most social media.
right? Condom. You set it there, and you want to make sure you get all that little bit of air out the best you can, because that's an important part. That releases the tension.
Now this is the point you're gonna know if you've got it on wrong or
Right, because like, see, I'm having a hard time because this is soft. It's hard to put condom on a soft banana, by the way. just say it's not impossible, but it
Do you
is
need my
difficult.
help?
It's harder if it's not hard.
Like
Right.
you need my help. Here we go.
So we're not demonstrating very well,
I think this is a very realistic demonstration.
right? Yeah. So yeah, it's hard to get that on a soft banana. More
Do
importantly,
you have a hard banana in the house?
no, I have one of these though.
Okay,
Oh,
So-
okay.
to rewind to earlier, the demonstration where you put it on your hand is a lot firmer than that banana, and it went on super easy.
There you go. This is a banana scented, but tastes like
Don't
banana.
bite
too.
it. Don't bite it when you're trying to put it on.
Right? It smells and tastes like banana.
Ooh, runs.
That's really cool. Tastes like banana runts. So get a banana flavored condom. This brand is called Trust X. So anyway, go ahead.
I might be telling on my own whorish nature a little too much here, but if you're the kind of person who might put a condom on your partner with your mouth, don't hold it with your teeth.
Can definitely tear.
Like even if it's not like a tear or like a hole, you could put like little tiny punctures that you can't even see into it, and it just takes one sperm getting out through one of those to make things happen.
Mm-hmm.
Oh my god, you're gonna scare me away for
So
weeks.
back to the demonstration, because I can't show toys either on fucking social media. So get that little bit of air out. See how it's kind of squishy?
Mhm.
There you go. That relieves the tension on the edge of the condom. So we're going to roll that down a little bit because, it's not a normal shape. Not all the penises are normal shape or regular shape. Some of them are curved, some of them are loose, some are round and angled. And
Some look like hammers.
so I broke my condom. So if that happens, stop immediately and
Even
start
if it's
over.
your last condom.
And if it's your last condom, you just fucking don't do it.
Time to go to the Walmart.
Also, I would like to bring to the table too. Decisions about any form of protection are not good decisions to make heat of the moment. That is something that should be discussed before you're naked.
Ideally, before whatever situation leads to being naked. Like if I'm going to go on a date with someone, I'll like straight up ask, "Hey, just in case, condoms?"
See, I'm the type that whether I ask or not, I put them in my purse anyways.
Always good.
I'm an over prepper, and I also have a lot of allergies. So even if my potential partner, like, say it's might be a hookup on the first date thing, we've all done that. I can't count on them to know my allergies.
Mm-hmm.
So for me personally, it's better to have it and not need it than need it and not have it.
Yeah.
And I mastered the condom while we were talking. Didn't want to interrupt. So, but like I said, that little bit of air at the top there, you want to squeeze that out before you roll it down. And as it being a hand, it's a little bit different. Get a little more room in there. But it's going to make that end a little squishy and soft like that right there. And then there you go.
So,
open your hand.
Excuse me?
Open your hand.
I can't because it's really strong. My hands are weak. I
So
can do hand exercises.
Condoms are much stronger than you give them credit
so
for.
I have to add a few things in that are very important within putting a condom on. Always look at your packaging and make sure your condom is not expired. Because an expired condom is a condom that's not going to be efficient in its workings. Yeah.
Hi, Lav.
Anything else I've left out?
Don't know when Lav popped in, but hi, Lav.
I would say let both partners look at the condom before it gets used. Because there's a lot of people out there who kind of really gross will like put a little tiny hole in through the packaging.
I've
Like,
had some motherfuckers take them off, and that it is okay to punch them in the face for that.
No, that's straight up assault. Do what you need to do to get out of that situation.
No need to apologize.
Get out
Lav.
of here with that.
So,
Ooh, my
It's
hands
okay,
are
Lav.
icky though.
It's okay, love. You're still the here's.
That's why
That's right.
washing your wiener is important.
so the next thing is something a lot of people really don't use.
Is it a dental dam?
It is a dental dam. So the directions say tear open the package carefully. Although it had like a little Ziploc
careful with
thing,
that.
but still be careful. It says don't use your fingernails, teeth, or anything that could damage the dam. Remove the dam from the package. Lay it flat, covering the entire vulva, including the vaginal opening and the clitoris. If engaging in oral or anal sex, cover the entire anus as well. Hold the edges of the dam during use to ensure it stays in place. This is optional. Moisten the vulva or anal area with any commercially available water-based lubricant before putting the dam in place. Taking care not to leave lubricant on your fingers. Lubricant on your fingers may make it difficult to hold the dam in place. And this one is vanilla flavored.
Hello, Craig.
That side is not vanilla flavored.
It said that the water-based lube is optional. And all of my experience, I have never used one of those effectively without the water-based lube. So I would say just fucking do it the whole time.
Yeah. And these are quite stretchy as well.
Mm-hmm.
You gotta stick your fingers in it. Put it back and stick your fingers in it.
Why would I stick my fingers in it?
Because that's how I want to see it work.
So
That's amazing.
Hold it between your fingers. There you go.
But you can still use your fingers.
But yeah. If it goes inside, that's not a
You
terrible
like me?
thing. Just don't let it get lost. If you do like use it to go, like if you put your finger inside and it goes inside, just make sure the whole thing doesn't slip open there. Go ahead.
You're very likely to put a hole in it if you just use one finger.
Yep. But if you use multiple or a whole fist, let's see how long it takes before it breaks.
But still,
As
that's
with
not
any,
that's not what it's used for. Stop it. Stop being bad.
Go ahead, Ray.
as with any form of barrier style preventative methods, should it break or slip up inside, seek medical attention afterwards to make sure you're good. If you need the plan B, medical attention will get there. If you contract something, same thing. If it malfunctions, go see a doc.
100%.
So they answer the question I was going to ask here, because the way they word it, I do like the clarification here. It says intended use, intended to be used as a barrier when engaging in oral vaginal sex or oral/anal sex to help reduce transmission of bodily fluids, harmful germs, and STDs. Warning, do not use during penetrating penile vaginal or penile anal intercourse.
Is oral anal sex salad tossing?
Yes.
Is that what they said?
Yeah.
That's what it's for?
Eating
So
ass.
it's not for penetration of any sort.
No.
The closest to full-on penetration that you should get with a dental dam is maybe inserting a tongue. That's it.
Mm-hmm.
You can do, like, very carefully, you can do fingers, you can do tongue, but it will not stand up to PIV
Very nice.
or PIA.
They come in a lot of flavors.
Yep. This was, it said it was vanilla. It kind of smells minty. So I think they're all
Yeah,
made
vanilla.
together.
My personal favorites are strawberry.
Okay.
Most brands have a strawberry. Always recommend.
I'm going to be honest. I've never personally used a dental dam. I just feel like it gets in the way of what I want to eat. You know, I'm not going to eat a sandwich with a wrapper on it. That's just me. But for safety reasons and absolute precaution, please feel free to use it. It's not going to change the sensation all that much. I imagine that would change sensation a little bit more so than like a condom would for a penis.
That's also part of what the water-based lube is for, because it helps get back to that very wet pressure
Oh,
that
okay.
you should be having with a tongue.
Very nice.
I
So
would absolutely
go ahead, Ray.
fucking wrap that poop sandwich up.
I just wanted to respond to Craig's comment real quick.
Oh, go
Sorry
ahead.
you had a bad day.
Same here, Craig. Glad you're here, though.
Continue.
That is, I'm just going to eat my condom while I'm here. Tastes like bananas, and I want banana runts now.
You do you, mister.
That's right.
Mister, if you're going to be that level of dumb, try to blow a bubble like it's chewing gum.
Coneheads. It's so much better because he's bald. Sorry.
Oh, that was fun. That was fun. This does not taste like anything.
Well, basically every banana flavored condom is going to taste like that, just so you know.
Yep. So get your. This is like I guess off brand is Trustex. It's a popular brand for folks. I didn't know that.
Trustex is one that our local Department of Health used to offer. You could go down, be like, hey, I'm just here to get some condoms, and they'd hand you a little paper bag with like 10 of them in it.
Mm-hmm.
Fun fact, since you mentioned health departments, you can also get latex-free condoms at most health departments. You will be more likely to have to ask for them because they're more expensive and they give you less of them, but they still have them. Still for free.
I think the dental dams will be great for buttholes. I think that's great. Wrap it up before you lick it. They have those for free too, usually at these health departments.
Mhm.
This is one of the brands that I've seen a lot given away.
One.
The one they have fancy pictures and stuff on it. I don't know how we only brought one home from there. But they have a really cool little contest going on that we all might get in on. We can design our own condom wrapper
Mm-hmm.
and then go vote for your favorites at onecondom.com.
Go ahead,
Can I
Ray.
add a side note? Just a quick side note with the dams too. If they are held properly in place, they can help displace. If someone's a squirter and you're not into that, they can help displace that so it's not squirting directly in your face.
Well,
Rain jacket.
we call that the weakest of the human evolution. So
Shush. Maybe
Again, dipping into my own horror side a little bit. Just waterboard me. It's fine.
right, I know what I signed up for.
I'm just saying they have multiple purposes.
You are correct though. Absolutely, like that is absolutely an option too. So if someone tells you, "Hey, I'm a bit of a squirter," lay that dam down and stop the water flow. That's what dams do. So keep it holders to his name. So what's your feelings on pulling out even if you have a condom on? Go ahead, Alice.
It's up to the people involved.
Right.
Like in theory, it not physically being in there when the climax happens is going to make things less likely to happen.
Right. That's me. For a while, we didn't use condoms at all, and then finally she communicated that she would like to. And I said, okay, because like it's not a fucking problem, and anybody that makes it a problem is probably not somebody you want to be having sex with. Just so we're clear.
And the reason why I communicated that is because my desiring urge to never procreate, like, really started burning deeper.
Mhm.
And that was prohibiting us from, like, being able to interact with each other. And I was just like, dude, we just have to use a condom and I'll feel so much better. And it'll just be better. And yes, you have to pull out too.
And that's fine.
I'm evil.
That is a very good example of it is perfectly acceptable for boundaries to evolve and change as you grow. You do need to communicate those changing boundaries, though. Like, you can't just expect your partner to know that your boundary changed.
And that was a big thing is, I think she was nervous about having that conversation. And I mean, whatever, if that's what you're comfortable with. I mean, if I wasn't comfortable with it, we would have had to have a different conversation, so we would have gone from there. And being polyamorous, it would have been like, well, I'm going to find someone else that will, and we're still together because we love each other, and we go on from there. But luckily, I'm not a jackass that cries because my wiener has a coat. Neat thing. So correctly using latex or polyurethane external condoms with lube can lower your chances of getting certain STIs, like HIV, with up to 91% for receptive anal sex and up to 80% for vaginal. So although they are 99% effective against pregnancy, they are not 99% effective against the transfer of STIs, depending on what it is.
That's because I can't think of the right word. Sperm is bigger than the little part. Thank you. Save me.
The sperm is larger than the micropores in the condom.
And the breakdown of the virus and bacteria is significantly smaller.
So your viral or bacterial payload can move through that membrane where sperm can't.
Very nice. See, and they always make it sound like condoms are 99% effective against STDs and pregnancy, and that's not the case.
Yeah, and like most STDs, it's like 80 to 90% effective on the like blocking of transmission. And even though that's not 100%, that's 5 to 10 times less likely to catch something.
Mm-hmm. And it's also 100% more effective than just sticking it in raw.
Yeah.
Yeah.
So as we talk about completion of condoms, when I personally finish, I take it out, wrap it, tie it up like a little balloon, Don't want your kids getting out of the house, Gotta lock them down. And then they are tossed in the trash. They're not flushed down the toilet because they are not exactly biodegradable. Or they're not exactly good for plumbing. They may be biodegradable, but they're not good for plumbing.
They will fuck up a septic tank quick.
They're not good for plumbing. They're not good for the earth. That's the best way they're good for the earth is going in your trash can.
My banana feels smoother now. Hey, it is cleaner. My banana's cleaner, you guys. Woohoo! That's because it's not a real piece of skin. So I imagine this material wiped clean with just a little bit of lubricant.
To be clear, putting a condom on is not an alternative to washing your banana.
Exactly. Also, it says to make sure if you're using condoms to use water or silicone-based lube, not oil.
Make your banana hard.
We can't do that on this. That's on OnlyFans.
Oil will degrade a condom, like to the point where, like, if you've got a particularly potent oil or a particularly fragile condom, it will sometimes even melt in places. That's
just a chemical reaction, right, with the latex or the polyurethane.
And you do not want molten condom on your dick. I'm sorry, your banana.
So there's a website called condomfinder.org. It's where you can find free condoms near you. So that's neat. I imagine most of it's going to be for health departments, but we wouldn't be us if we didn't research.
See, you just weren't being delicate enough with it. I'm doing just fine. See?
Well, condomfinder.org is no longer a site.
Just roll it down.
So
I'm having a little trouble at the girthy part right here. I got a little girthy. But it is important that it goes all the way to the base. We're just going to call that the base. These can be my boys down here. There we go.
So
successfully.
So all the condomfinder.org is no longer one. You can do myiacondoms.org or .com.org. Fuck, shut up. Whatever. That's just for Iowa.
Nifty fact, the Snapchat AI that has been recently released, if you type in where can I find free condoms, it will show you places.
Very nice.
I didn't know that. That's fucking awesome.
So I just got happy for my website, y'all. I went to the NPN, through the NPIN, through the CDC, and they have a widget I could put on my website. It has the code directly on the site that it will tell people where they can find condoms.
That's really neat.
So that's neat.
Yeah.
So that's going up for sure.
Mm-hmm.
Yeah. So there's a whole bunch of stuff. There's just like so much, but we could probably do this show for like fucking 3 days and not run out of information to give. And Alice, well, Alice had some things about preventative measures for STIs. Absolutely want them to present that or talk about that for a second.
I'm going to be here, but I'm going to go ahead and start getting ready for bed. I'll be listening though, okay? Oh, my butt stuck in the chair.
So the three big things to like minimize: condoms, dental dams, testing. Right? You can't catch an STI from someone who doesn't have it. When you have, like, if you have multiple partners or your partners have multiple partners, then you start running into like a broader net of exposure, and that's where condoms and dental dams come in for STI prevention. Like we mentioned, they're not 100% effective. So if you have an experience with a new person or a person that you've had before, but they've had new partners since the last time you had an experience with them, go get tested. In theory, everyone would be aware that this was going to happen and ideally be tested ahead of time. But, you know, the heat of the moment, hookups, whatever, that's not always possible. So if you're in the position where you've gone, like you've had this experience, you've used protections, still go get tested.
Very nice. Very nice. One more thing as far as testing goes, I have this little pamphlet I did want to read a couple things out here for. It talks about being honest with your healthcare provider when you do go get tested. Some questions, you may feel embarrassed or they may feel very personal. Go ahead, Alice.
One of my favorite questions when I go in, because like I'll go to Planned Parenthood and just be like, hey, I've had a new partner, I want to get tested, and they'll do a urine and a blood test, but they have like this battery of questions, and they'll run down, have you done this in the past 6 months? Have you done this activity in the past 6 months? And the whole list is just, yep, yes, yesterday, yes. The whole entire list.
So some of the questions they may ask, have you or any of your partners used alcohol or drugs when you have sex?
Mm-hmm.
Have you ever exchanged sex for drugs or money? Do you sometimes have sex without condoms? How many sexual partners have you had? What kind of sex do you have? And in the past 3 months, have you had sex with someone you had just met? These questions aren't or shouldn't be for a judgment. They're just asking so they can make the right recommendations. Some questions that you can ask your provider. So based on the sexual activities I engaged in, what should I be concerned with, or what preventative measures should I be taking? What tests should I be getting if I am a top, a bottom, versatile, a switch, or in an open relationship or polyamorous? I have noticed whatever concern you have, and it worries me. What can we do about it? So the right healthcare provider is going to give you good information and not fucking judge you. It says if you have more than one sex partner. Go ahead, Ray. Sorry.
It is always okay if you do not feel that your healthcare professional has taken your concerns as valid to get another opinion. Know your body.
I'm going to make a recommendation on being an asshole, but not breaking the law. If you have like a healthcare provider who's not listening to you, who's like ignoring what everything you're telling them, walk the fuck out of the appointment, go find another one. And when they send you your bill, don't fucking pay it.
Yeah. It's important to find, if a doctor doesn't want to test you, you ask them why.
Sorry, go ahead.
I was just gonna say they shouldn't have a reason to. One, if it's about money, then whatever, what you're expecting to pay more or whatever. So, but also if it's insurance, stuff like that, look for other places that can test you for free.
If you have like a shitty doctor who's like kind of skating around testing and like you don't really want to just walk out of that, you can always ask them to note that you requested testing and that you were denied. And usually they'll find a reason to let you have that test anyway.
They don't like putting in there that they said no.
Mm-hmm.
And this little booklet suggests if you have more than one sex partner or have casual sex with people you don't know very well, you should be tested every 3 to 6 months. That is important as well. I don't think there's anything about this in for like. Oh yeah, so there's PEP. There's something about PEP you were talking about, the post-exposure prophylaxis. You need to start taking it within 72 hours of exposure, but the sooner the better. PEP requires taking prescription medications every day for 28 days. You can get a prescription from an emergency room, a 24-hour clinic, or any healthcare provider. And PEP is usually used in emergency situations.
And PrEP is the one where you plan ahead of time and prepare. So like that one, you'll have medicine that you take for a certain amount of time before and after the encounter. Or like if you have a recurring partner, it'll just be a running prescription.
So real quick, before we move on from this kind of stuff, it says if you don't have a healthcare provider, you can find one at any of these resources, which I'll also put in like a description later for the YouTube videos and stuff. AIDSVU.org help you find testing locations and care services in your area. PrepLocator.org can help you find a healthcare provider to talk to about PrEP. And then glma.org has a database of LGBTQ friendly healthcare providers. So that's a good one to have. Talking to your partners says potential ways to start a conversation. I'd really like us to have sex, but I think it's important we both get tested for STIs first. I have HIV, doesn't mean we can't have sex. We'll just need to take the proper precautions. If you would like to take the next step in this relationship, we can get tested for STIs at my clinic, or we can even try an at-home test, which there will be another link for in the description of all this stuff. And then whether your status is positive or negative, I just want us to be open and honest about it. Once again, communication is key. So, yeah. So we talked before the show to Ray for a second about this someone we met this weekend that's an affiliate with the Gilead, and that's how we got like so many resources, like these little books right here. There are so many of these. I don't even have them all right here, but they gave me all this stuff, and I'm going to be passing them out. It's called the Healthy Sexual Handbook, and that's where a lot of this information came from. Where was I going with that? I was going somewhere with that.
The class.
Oh, yeah. So he told me to get in touch with him, and then we can work on getting a class that'll get me certified to teach this stuff. And anyone else that I know that wants to be able to teach this stuff, will get us the information, the slides, all the things we need to give an actual presentation. So that will be kind of neat to do. If anybody's interested in that, please send me a message.
Absolutely.
Yeah, so I'll get in touch with him, and we will find out, because STD rates are on the rise. Protect your boo.
That's so cute.
I know, right? So, a couple more facts about like PrEP. Daily PrEP can lower the risk of getting HIV from sex by more than 90%, and from injection drug use by more than 70%. Yeah. So birth control. Swallowing is the most effective form of birth control.
If we're going to be ridiculous, I might actually argue that abstinence would be.
Oh,
but
yeah.
No one who didn't grow up in a puritanical household is going to be abstinent.
Right. Because even though our ace person isn't here, asexual people can still have sex. So.
And can still enjoy it. They just don't feel the attraction.
Right. So abstinence is an option, but only if you choose so for the right reasons. Not because Sky Daddy said you had to not take it. Carry on. Okay. Birth control. So, Ray, I'm sure you and everybody else here knows more about birth control than I do, honestly. So feel free.
Oh shit, me.
You're doing great.
Sorry, I did it again. There's a lot of different forms of birth control, both hormonal and non-hormonal. There are sorry. There's varying degrees of permanency. I don't know. They all basically work on the same concept of not allowing implantation.
Okay. So
I flubbed a little there.
no, you're fine. So as a Lav has a question. There we go. Let's answer that.
Yes, there is non-hormonal birth control. The one that I know the most about is non-hormonal IUDs. I had one for 5 years, and the first one I had absolutely no problems with. Non-hormonal ones tend to, on average, be lower in side effects. Again, it depends on your body chemistry and the materials, but they tend to be less risky as far as side effects go. Yeah, I said the first one was a good experience. I would never do one again either. The second one, I almost died.
I don't mean to sound like a selfish prick, but I also don't want Lav to have an IUD again for self-preservation reasons.
You don't want it stabbing your banana.
Don't want it stabbing my banana constantly.
So, genuine question though: do y'all think they will ever make it less painful to get an IUD?
No.
Maybe, but that would be entirely pushed by women, and it's going to be hard to find anything in the medical field that's entirely done by women.
Fair.
Yeah.
Speaking of gender and birth control, there have been several studies where they tried to create birth control, like hormonal birth control for men, and like every single time it fails because the men can't handle the like side effects of the hormonal birth control, like acne and mood swings. But women are expected to.
Yeah, I would agree that if it is improperly placed, it is one of the most painful experiences. Would you guys like to hear my IUD horror story real quick?
Absolutely, if you're comfortable sharing.
Absolutely. So I was having sex with a partner that was wearing a condom, and at one point I went dry, which is very rare for me, but that's besides the point. I went dry, and in the process of him trying to pull out while I was dry, the string part of my IUD got snagged on the condom. It pulled out the IUD with enough force that it broke in half on its way out, and half of it embedded in my uterine wall, and I almost bled to death.
Oh, Jesus, that's rough.
And if you never want to ever have to I don't know how. Oh, I'm sorry. Mwah, mwah, mwah. Kisses.
So they have an on-demand male contraceptive that has shown promise in a preclinical study as of February.
Is it the Switch?
No. I'm trying to skim through the article real quick. I know they have a gel they've been working on.
There was I don't know that it ever went anywhere, but there was one I read about a while ago that was like you would route the vas deferens through a switch, that it was like just a vasectomy that had basically it was a light switch. It actually got used in, like, that idea got used in one of my D&D games with Lav, so that's probably going to sound very familiar to them here in a second.
That would be interesting, though.
Yeah, and it was just like a toggle switch you could just like press, and like it would go, if it was open, things were flowing, and if it wasn't open, things weren't.
That's interesting. I hope something comes of that. That would be neat.
Okay, this might just be me here, but they might have to be careful with placement of said switch so your switch doesn't get flipped while you're fucking.
Clapper.
Sorry.
So the non-hormonal pill they've been working on, this was in 22, is the last article I could find about it. It says it attacks or it targets the protein on the retinoic acid receptor, alpha, whatever the fuck that means. But it works in male mice, and it is reversible as far as they could stop taking it and their body would start producing what it needed to again.
So by targeting that specific protein, what it's doing is it breaks down the coating around the sperm that protects it from the acidity of the vagina. So it makes the sperm easier to kill by the vagina.
Nice. So, very nice. Turns the whole vagina into a war zone.
The vagina is already a war zone. It weakens the soldiers.
Survival of the fittest. They did say that they will begin. So they begin human clinical trials in the fourth quarter of 2022 because it can be difficult to predict if a compound looks good in animal studies will also pan out in human trials. So there's a possibility for that.
They have to get enough men that can handle the potential side effects.
Right? So in between 2015 and 2017, 63.3% of pregnancies among women between 15 and 49 were unintended.
Yep.
That sucks.
Both of mine were unintended. I call them my unplanned miracles.
So according to research, back to the condom thing, condoms actually have an 11 to 16% failure rate based on the study for the National Institute of Child Health and Human Development.
A lot of the failure rate is contributed to operator error.
Yeah. Oh, yeah. Vasectomies have a failure rate of under 1%. However, even though people think they're reversible, only 85% of vasectomy reversals are successful. So you 15% chance of being infertile.
There's a 100% chance of being infertile if you get an orchiectomy. But it's real hard to get that as a dude.
Very nice.
You would also then have to supplement testosterone.
Well, that wouldn't be fun.
Does it show by chance the successful rate and the reversal success rate for tubal ligation? Just for comparison.
While Alice is looking that up, I had a thing that made me laugh the other day inappropriately. It said vasectomies don't prevent your partner from having babies. They just change the color.
Gross.
Right.
Tubal ligation, specifically like tubal sterilization in general, has at a 10-year failure rate of 18.5 per 100 procedures, which comes out to like just under 2%.
So it's fairly successful.
And then the reversal rate, or the pregnancy rate following reversal, varies from 50% to 80% depending on the person's body.
Huh.
So the reversal is a lot more difficult than the reversal of a vasectomy as far as successfully getting pregnant.
Yeah. So for like the tubal ligation, a not insignificant amount of the fallopian tubes is removed as part of the process, and a much smaller amount of the vas deferens is removed during a vasectomy, if any at all.
When I look at the statistics like that, I feel like a medical anomaly. Like, it has such a low rate of failure and failure. And it wasn't after 10 years either, because I had it done a couple of days after my son was born, and he's only 9. So I would say roughly 8.5 years in, I had a miscarriage.
While we're on the topic of like contraception, there's one that is like very promising as a male one that actually doesn't have a whole lot of side effects because it doesn't fuck with your hormones. It's this injection called Risug, RISUG, and if you give me a second, I can tell you what that stands for. It's currently in phase 4 clinical trials right now. Reversible inhibition of sperm under guidance. Basically what it is they inject this specially designed polymer into the space around the vas deferens, which then changes the pH of that entire environment so that it is no longer able to like have sperm pass through it safely. And then once that like when you're done with that, they just give you another injection to dissolve the polymer that was injected, and then you just piss that out. And like it's showing like consistent, I think it was 98% was the statistic on their success rate of like, or technically 2% failure rate of people still getting pregnant on it. So already better than condoms, and like 100% success rate at reversing.
Nice.
That's nice. The reversal rate is very nice to hear.
Yeah.
The one I was looking at, and one of the most recent ones that's been researched is Nest gel, Nesterone testosterone gel, but it is hormonal. So by giving men a combination of these two hormones, it blocks the signals from the brain to the testes, the same signals that regulate the menstrual cycle in women. By blocking those signals, the testicles stop testosterone production. Without that high testosterone levels, the sperm in the testicles fail to mature. So it shows that according to this study, 90 to 95% of the men who used the product for 6 months as directed met the threshold for low sperm count. So it works if it's used daily and is very well tolerated by the body. So that's nice.
Mr.
Yep.
Low sperm count is not sterility.
Nope.
It just takes one good swimmer.
Right. Because it just talks about suppression of the sperm production. So I guess it's more of a inhibitor than it is a contraception. Like it lowers your chance, but not preventative.
Yeah. And then you also have the hormonal issue of like when you start blocking testosterone levels, like I do with my anti-androgens, if you don't have another sex hormone and the other option is estrogen, you start running into things like chronic fatigue. If it gets low enough for long enough, like organ failure or your body beginning to deteriorate.
That's a hell of a side effect.
Yeah, that's why you take estrogen with it when you're doing
Right.
HRT, and just having one of those two prevents all of that.
That's great. Because I don't think I could take that chance of like.
Yeah, so like with my HRT, like I'm just got the last letter of referral I needed for an orchiectomy. So after that surgery, if I ever stop like taking estrogen, I would have to begin supplementing testosterone immediately, because those symptoms set in after about 6 months of both being low, and like there are other less pleasant symptoms much longer down the line.
So pardon the ignorance. You said an organectomy.
Orchiectomy.
So what is that, if you don't mind me asking?
Keeping the dick, getting rid of the nuts.
Oh, okay.
I plan to put them in a little. I plan to put them in a little jar with like my dead name, my birthday, and the day I started HRT.
Very nice. That'll be very symbolic and beautiful.
And as far as I know, as far as I figured out, that's the only surgery I'm really going for.
I'm glad you finally got that approval.
My therapist sent me the rough draft of the letter that I needed this morning for me to look over, and I went, yeah, it looks great, and I'll have a physical copy of it by next month.
That's fantastic.
That makes my heart so happy.
It makes mine pretty happy too, but thank you.
No, I love you so much, and it makes my heart so happy to know that the things are coming to the things for you to be more you. I love it.
And I also get to stop taking the anti-androgen after the surgery, which, poor Lav, because the anti-androgen tanks your energy.
And this is you with low energy?
This is me with low energy. Poor Lav.
I know, poor Lav. Oh, man. I hope they're ready.
They're not. They're not going to be.
So, one last thing I saw as far as like the male birth control goes, they are working on a on-demand contraceptive that is you take it, where did the shit go? Jesus. 3 to 6 hours before intercourse, and it doesn't target the sperm production, but it targets the movement of the sperm. They target hyperactive swimming. Non-hormonal methods target different parts of the sperm maturing or function, but all the hormonal methods work by that same mechanism of action, and very mostly in their delivery form. So, since the
What's the name
boys, let's see, I don't have a name. It just says on-demand male contraceptive. Here, I can. It's from Life Sciences Intelligence. There's a feature on theirs. Look for a name though.
I am seeing the original article on Nature Journal, which is like the actual publisher journal.
Okay.
On-demand male contraception via acute inhibition of soluble adenylyl cyclase.
Yeah. Whatever those fancy words mean.
I'm going to read that later, and I'll translate that into Mister for you.
There you go. Just give me the 3rd grade version. So we talked about IUDs. We talked about male birth control. How about the Implanon? Any experience with that, or know anybody that has experience with that?
Most of the people that I know that have used it have had fairly successful experiences with it. I haven't used it personally.
Same here. I've seen people that have it, and I've felt it. Like, you can feel it. Like, you can physically feel that in there. It's kind of crazy. But I know people that have had quite a bit of success with it, and then it's simple to just take out.
I will say, because of personal experience, if you have a history of blood clots, the Implanon is generally less acceptable to use for your system even than taking the pill. Neither one are recommended because they do increase that risk.
Okay.
I had blood clots in my brain, and I can't be on most hormonal birth controls anymore.
I was gonna say it takes an intelligent. I mean, I know most doctors go to medical school, stuff like that, but it still takes an intelligent doctor to think of things like that. To go, okay, well, this can affect this part of your body. This part of your body is having issues right now. Let's try something different.
This is where I will plug being your own advocate and doing your own research. Especially for any pre-existing medical condition, it is important to do your own research, especially if you're going to a new doctor. Do your research, know what is going to be harmful to your body, and communicate that with your doctor. If they are a good doctor, they will listen, and they will know information that will back up what you're telling them. If they do not listen, they are not the doctor for someone with a pre-existing condition.
Okay.
I just saw Lav's comment.
Did
Did you check
I'm
private
not
chat?
going to be able to walk. I did see something here. So this is specifically talking about the STDs thing. It just caught my eye. It says, don't use condoms made of animal skin. While they can prevent pregnancy, they don't work very well to prevent STIs.
They're more porous.
So
again, it goes back to the size of the molecules. Molecules! That's the fucking word I couldn't think of.
I love when we have moments of remembering the right words. Because we all get so excited every time we do it.
But
especially when we think, like, we say something like an hour ago, and then like it just clicks to us, and we're like, oh yeah. Let's see. Pre-lubricated condoms help prevent it from tearing. Replace condoms you keep in your wallet and purse often. Don't be carrying the same wallet or same condom you've had when you were in high school and you're like 30 now. Go ahead, Alice.
In my travel bag, I keep a box of condoms, and either when that box is empty, which hasn't happened in a long time, or when it's been 6 months, that box gets thrown out, new box condoms.
The reason you should replace the ones that you keep in like your wallet more frequently, body heat makes them break down.
Also,
keep
like,
it-
sorry, go ahead. I'm sorry.
If you keep it in a purse or a bag, there is less contact with your own body heat.
And there's a less constricted space, so you're less likely to constantly be putting it under tension. Just give every person, man, woman, other, a purse, and have them keep their condoms in there.
You gotta have your hoe bag.
Gotta have your hoe bag.
Gotta have a hoe bag. That's
Condoms, toothpaste, toothbrush, baby wipes. That's your hoe bag.
and a change of clothes.
Optional.
Optional. You're right. Optional.
If you're hoeing it up properly, you weren't wearing clothes when it happened.
My whole bag had at least 10 pair of extra underwear in there.
I don't
That's
know
a
if
fair one.
I was gonna say I don't know if y'all could hear or not.
Mhm.
Yes. Listen, I'll be real. Like, if I'm going anywhere overnight, whether it's a hoe adventure or not, I'm bringing some extra pants. I got mom bladder, y'all.
Things just leak.
No, I get the holy crap, I have to peeing.
Okay. Although this is important every week. I know. Although it was like last week was the consent talk too. I have this one, it's Consent 101, and I feel like it's important to read. Verbal and nonverbal consent is sexy. It sounds and looks like so many different things. It could be yes, yes, yes. Don't stop. I want you to. Non-verbally nodding or giving a thumbs up. What it sounds like when you don't consent. No, I don't want to. Not right now. I'm not sure. Silence, non-responding, or pushing away.
So I wanted to bring back up something Alice said earlier to a response to Jen. If you have consented to a sexual act with specific boundaries in place, like using a condom, something like that, if the partner removes those boundaries without your consent and continues, it is assault at that point because you did not consent to the activity without that preventative.
Absolutely.
To put a specific example, if you're fucking with a condom and the guy is behind you and he pulls the condom off without telling you and goes back to, that's assault. Make him bleed on the way out.
Absolutely. Because consent is as easy as fries. I love fries. Fries like the coolest little thing. It's freely given, reversible, informed, enthusiastic, and specific. So it's always important.
If
This
you're
one's-
not sure if someone has consented or not, they haven't
Yep.
until you are sure.
Oh, Alice, I thought you were getting ready to say something. You were chewing? Yeah. Okay, go ahead.
The reversible is kind of the biggest point to me, that like if you're in the middle of something and like you have like a moment where you like have a flashback to a traumatic event, or like the mood just goes away, there doesn't have to be like a specific reason, but you can say no in the middle of. And if the person you're with tries to force you to continue past that no, it is also assault.
What the fuck?
That's a spam.
Okay.
And it's
Cool,
just
we've got-
somebody on
we've got-
Facebook.
But that's cool though. That's a mile marker too. In the same night, we've gotten our first Jesus troll and our first spam. Fuck
Yes.
yeah.
We're going places, people.
I am 99% certain what they're supposedly selling there is phone sex for 15 minutes.
$50 for 15 minutes.
Something like that, yeah.
Better be good for that much. I'll be done in 3. What are we going to do for the other 12?
I mean, that's actually not that expensive for that as someone that does that.
Yeah, so go up in your rates there. Rajni, I'm guessing is how you say your name. Go up on your rates. You're better than that. So consent must also be obtained before each new sexual activity. For example, if someone consents to kissing, it does not mean they consent to taking off their clothes. Get in the practice of asking consent when you feel like switching sexual acts. It's also important to ask your partner if they're enjoying what's happening, such as, do you like this, and being open to feedback. If your partners say no, seem unsure, don't say anything, it's best to stop to check in and ask what you could be doing better.
Maybe not better, because like partners will
Different.
get like defensive or like feel like they're like insulting you. What would you like me to do differently is a much safer question to ask.
There you go. Here are circumstances in which consent is not informed or freely given. If your partner is sleeping or unconscious, unless consent's been given beforehand.
The whole phrase, like specific consent, all of it.
Yep. Incapacitated by alcohol or drugs. Not of legal age. Feeling pressured to say yes. Or if there's someone that's in a position of authority or trust, such as a teacher or a manager. Asking for consent can sound like many different things. Do you want me to keep going? Is it okay if I take your clothes off? Can I kiss you? I think it's hot when we blank. Do you want to do that? Are you comfortable with this? Go ahead.
My favorite way to get specific consent is to look someone in the eye and to tell me what you want me to do to you. And they just sort of, most people will just kind of like pause for a little bit and stammer out what they want eventually. Ray, you doing okay?
You good over there? You good over there? Okay. All right. You were free to come back whenever. So yeah, I mean, this I feel like it's all important. Last week, this week, and next week is all going to be important stuff. Because education it's the foundation of like knowing how to do things right and properly and carefully. All those fun things. So yeah, I think everybody should get on the one condom design contest. It's onecondoms.com/design contest. And if you win, you can win cash, a year's supply of condoms with your name and art, and a donation of condoms to your community or school.
Can the fucking power move to show up with condoms that have your own name on them?
Right. Right. Like this guy fucks. I don't have any more toys to really play with. I've got lube, but lube is lube. I mean, I'm not gonna get lube out because it's all messy.
Oh, we should talk about the different types of lube just real quick.
Absolutely. I think these are both. Let's see. This one's aloe. Says it's from Lifestyles. It's not made with parabens. This is water-based. It does say water is the first ingredient. Same with this. This is water-based. You also have silicone and oil-based.
Oil. Yep. If you are using silicone toys, you want to use water-based lube. The silicone can cause them to melt. Oil can cause them to break down. And in both cases, you have a real risk of like bacteria buildup because you can't properly wash them. But if you're using glass or metal toys, use silicone to your heart's content because it's going to be the best one.
Absolutely. Let me do this right here.
silicone, as long as you're not using something that it reacts with, will give you the best lubrication because it is the least absorbable by the body. So it stays and it doesn't get soaked in.
So
it
they
doesn't dry
have,
out.
yeah.
And it doesn't get sticky. Sticky lube hurts.
Oof.
There you go, Laugh.
My favorite toy, I'm not going to be too specific, but my favorite toy is the size of my arm, and sticky lube is a nightmare.
Oh, ow, not fun.
Mm-mm.
But there's that URL, Lav. I think they have a active contest right now. But they also have like the design gallery, so you can see like the past stuff and all that stuff as well. So that'll be neat. Definitely enter in that. Pop that off. There we go.
Oh, my moving to the side, I couldn't word at that particular point in time, but was for the space art thingy.
Oh,
that
yeah.
Lav said.
Yeah.
Sorry.
Well, that's cool. So,
You're good.
yeah, no need to say sorry. Well, maybe the contest isn't going down now. I don't know. But either way, that's the link for it. Okay, they just had one end. That's what it is. So, yeah. But they do have a spring contest and a fall contest sometimes. Last year, the fall contest was July 1st to 31st.
That's not fall.
Right? Yeah, their judges voting is January 1st to 31st, and then the public voting is February 1st to May 31st. So, like, it's the craziest. That's not fall at all. But if you win the staff pick, you get $100 cash and a year's supply of the condoms with your design. If you get an honorable mention, you get $200 cash and a year's supply of your design, plus a donation of 1,000 condoms to the nonprofit of their choice. And then if you are a winner, then you get $500 cash, a year's supply of your condoms, a donation of 3 condoms to a nonprofit of your choice, and then an artist profile page at onecondoms.com. So we'll keep an eye on that.
My brain went to the question of what is a year's supply? Like, are they giving you one a day? Or
I mean, catch me in a good mood. One a day is not enough. So, like, do you sit down and go like, here's how many I go through, or how many times I'm fucking, give me that many?
Or do they just have some arbitrary number that they expect to last a year?
You okay?
Yeah.
Okay. Oh,
Bye, mister.
Mr.'s abandoned ship.
Oh, bye, all of us. Oh,
There we go. Okay, sorry. My internet went stupid for a minute. 365 is what it says, so I guess it's the condom a day.
That's not enough.
okay.
You good there, Ray?
Yeah, I was the only one on there for a second.
Oh, nobody was here. It was just me, and then it was just you, and then
you were gone, and it was me and Alice, and then Alice was gone, and I was like, oh fuck.
Yeah. So it just, my internet goofs up every now and then. Thank you, Spectrum, for sucking. I used to like talk trash to Spectrum on Twitter all the time. But yeah, so it's like people design simple things like this. There's one design that has 2 girls and they're kissing. There's another that has like a little alien face on it. It's kind of cool. So design away. I don't know when the contest will be going on. That'll be fun.
I'm just saying the winning design should have glow in the dark so you can still find them with the lights off.
Exactly. That is important to have.
You have no sense of adventure. Like, if they put the condom on and you turn the lights off, use your mouth to find the condom.
No, like the package.
Oh, just keep them in a place, you know.
Sometimes you might play like a Quiet Place or whatever that other movie was. where it was dark.
Or you might,
Bird box?
kick the dresser and knock them off, and you gotta find them.
Dicks that are out of this world.
If you haven't made it to using a condom and you're already at the point where your legs are flailing so hard you're knocking shit off your dresser, I think you might need either to take it down a notch or to stop worrying about the condoms.
That is. Oh goodness! Sorry. So, closing thoughts, anybody?
Whatever protection you decide to use, discuss with your partner. If they say that a protection is required, accept it, or you're a piece of shit.
Consistency is key. Whatever form of protection that you decide on with your partner, be consistent with it. It only takes once of not using said protection, and you're not protected.
Educating yourself is probably the most important part of it. Educate yourself on consent. I'm not going to say you should know what consent is, but if you don't know what consent is, you probably should. But either way, learn. That's like the most valuable thing in being a human. Oh, I got both of you with a hand over.
Go ahead, Ray.
If you don't know what consent is, go back and watch our earlier munches. We do have one that specifically details what is consent.
And if you don't know what consent is, don't put your genitals near anybody until you do, and you have consent.
Any closing thoughts, Princess? She's doing her mouth rinse thing real quick. But yeah, consent is more important than I think than any condom, any testing, anything like that, because consent is where it all starts.
I'm going to be an asshole. Communication is where it all starts, because if you don't communicate, you can't have consent.
Ray, got you there?
Absolutely. Anything from the Princess Palace over there?
I'm sure you guys got it all covered. Do your own research.
Do your own
Know
research.
your own boundaries, as always. folks.
That wraps us up this week, and we'll see you next week, where we are talking about things that I don't have pulled up. I think it's like communication, consent, and stuff like that. Some more foundational things that are beyond physical.
I believe exploring is in there too.
Oh, exploration is absolutely in there. So we'll learn more about boundaries and things like that. I'm excited for it. I hope everybody else is excited for it. If you're not, then get excited for it. So, love you all. And
Double love.
good night. Good night, love.
Good night.